let's just jump right in. Today, we're talking about something absolutely crucial for your family's future, a literal, life-saving tool that can protect our kids from cancer. We're diving into the HPV vaccine and its massive role in preventing cervical cancer right here in India. Honestly, this is one of the most important health conversations we can have, so I'm really glad you're here. Here is our roadmap for this explainer. We're going to cover India's cervical cancer crisis, understand the HPV connection, look at the ultimate prevention tool, discuss who, when, and why, compare vaccine options in India, and finally, separate fact from fiction.
Right. Section 1. India's cervical cancer crisis. Just think about this number for a second. 123,907. That is how many new cases of cervical cancer are diagnosed in India every single year. Just let that sink in. That is over 123,000 mothers, daughters, and sisters getting a completely terrifying diagnosis year after year.
And tragically, the toll is immense. Over 77,000 women lose their lives to this disease annually. It's actually the second most common cancer in Indian women right in the prime of their lives, between the ages of 15 and 44. To put that into an even more heartbreaking perspective, one Indian woman dies every 8 minutes from cervical cancer. Literally, every 8 minutes. And you know what the most frustrating part of that statistic is? The reason doctors are practically begging us to pay attention? This disease is almost entirely preventable.
When you zoom out and look at the whole world, India alone carries a massive 21% share of all cervical cancer deaths. We hold a fifth of the entire global burden. That is a heavy, heavy weight for our country, and it's a reality we desperately need to flip for the next generation.
Moving on to Section 2, understanding the HPV connection.
So where does this all start? It comes down to the human papillomavirus, or HPV. Now, HPV isn't just one thing, it's actually a whole group of over 200 related viruses, and it is incredibly common. Actually, about 8 out of 10 women globally are going to get infected with HPV at some point in their lives. While a lot of those strains are totally harmless, at least 14 of them are considered high-risk types that literally cause cancer. HPV types 16 and 18 are the main culprits here. They cause roughly 70% of all cervical cancer cases worldwide. The catch? You can't actually treat the infection once you have it, but we can absolutely prevent the cancer it causes.
Which brings us to Section 3, the ultimate prevention tool. The good news is we have a solution. Trusted organizations all over the world, like the International Pediatric Association, the Indian Academy of Pediatrics, and the World Health Organization, are all championing the HPV vaccine. And guys, this isn't just your standard routine childhood shot. It is quite literally a cancer prevention tool. When given before someone is ever exposed to the virus, it can prevent over 90% of HPV-related cancers. It is an absolute medical marvel.
And if you're wondering about safety, the amount of data we have is just staggering. This isn't some brand new experimental thing. The vaccine debuted way back in 2006. Since then, over 135 million doses have been safely given in over 100 countries. We have more than 15 years of really rigorous post-licensure safety monitoring, proving that it's safe, highly effective, and gives long-lasting protection.
Okay, Section 4. Who, when, and why?
The Indian Academy of Pediatrics strongly recommends hitting what they call the golden window, which is between ages 9 and 14. Why that specific window? Because a preteen's immune response is super robust. If you get the vaccine then, your child only needs 2 doses, spaced about 6 months apart. If you wait until they're 15 or older, all the way up to 26, they're going to need 3 doses to get that exact same level of protection. So going earlier is just absolutely better, both for immunity and, honestly, for convenience.
Oh, and we definitely need to shatter a really common misconception here. A lot of people think this is only a girl's vaccine because we always talk about cervical cancer, but boys absolutely need this protection too. The IAP recommends starting boys at age 9, just like girls. Why? Because HPV causes other serious cancers. In fact, throat cancer or oropharyngeal cancer is the fastest growing HPV-related cancer in men right now. The vaccine also prevents anal and penile cancers as well as genital warts. Plus, when we vaccinate boys, we build community immunity, which stops the virus from spreading to absolutely everyone.
Let's look at Section 5, vaccine options in India.
If you're ready to get this for your kid, you've got choices. We now have India's very own, highly cost-effective vaccine called Cervivac, made by the Serum Institute of India, alongside the international option Gardasil 9. Both are approved for boys and girls. Both protect against those high-risk types, 16 and 18. Cervivac covers 4 types of the virus at roughly 2,000 rupees a dose, which makes it super accessible.
Gardasil 9 covers 9 types, preventing up to 90% of cervical cancers, but it does come at a higher premium, around 10,850 rupees per dose. The huge takeaway here is that families finally have really solid choices based on their budget and what kind of coverage they want.
On top of that, the Indian government is taking a monumental step. In February 2026, they launched a free nationwide campaign under the Universal Immunization Program. This is a massive public health push, specifically targeting 1.15 crore 14-year-old girls every single year across all states. They're even using the digital YouWin platform to track everything. It is a massive, massive leap toward wiping out cervical cancer for good, regardless of a family's financial situation.
Finally, Section 6, Fact versus Fiction.
Now, let's talk about the fears. This is probably the most common thing parents worry about when they bring this up with their pediatrician. Is this safe, and is it going to mess with my child's future fertility? It is a totally normal question, so let's just look at exactly what the medical community says.
The science here is crystal clear. There's absolutely no confirmed link between the HPV vaccine and infertility, autoimmune conditions, or any chronic illness. Period. None. Also, it is perfectly safe to get the shot while on your period. It doesn't mess with your cycle at all. As for side effects, you're really just looking at the standard temporary stuff you get with almost any vaccine. You know, a sore arm, a little redness, maybe a brief low-grade fever. That's it.
Here's another one. Sometimes you're doing a quick web search and you see confusing phrases like HPV vaccine baby floating around. It makes parents panic thinking, wait, did I miss a shot when my kid was an infant?
To be absolutely clear, no, you didn't miss it. This is strictly a preteen and teen intervention. The very youngest recommended age to get this is 9 years old. It is absolutely not part of the standard infant immunization schedule. The whole point is to empower parents to protect their growing kids well before they reach adulthood and might actually be exposed to the virus.
So we know the grim reality of the crisis, but we also have the safe, proven tools to fight it. We have affordable, locally made vaccines and massive government support. The World Health Organization is quite literally calling for the global elimination of this disease. So the only question left is, armed with all this knowledge, are we going to be the generation that actually takes action, ensuring no child in India ever has to suffer from an HPV-related cancer? Have that conversation with your pediatrician, ask the questions, and let's protect their future. Thanks for joining me for this explainer.